Hi, this is Tommy here from Active Physical Therapy. I'm going to talk a little bit today about a rehabilitation of adductor-related groin pain. So we spoke in the blog before about assessment and diagnosis. Once you've that made, you can go with your rehabilitation. In terms of your rehabilitation, you need to make sure, or you need to think of everything between here and your knees. Okay? So one, making sure that your T-spine and your lumbar spine, there's no restrictions there, it's aligned properly. Making sure that there are no hip restrictions, so there's not too much stress in the tissues inside that from hip with limited range of motion. And then clearing up any soft tissue restrictions. Basically anything that can increase or add load to the pelvis. Once you've that done, then you go with your rehabilitation. In terms of your rehabilitation, a lot of glute work, strengthening and endurance work from everything around the pelvis, and a lot of pelvic control work. I would get people rehabbing and exercising early. Initially there might be a lot of static work, and then you move on to a lot of dynamic control work. So let's go through some of those exercises now. Making sure that everything is pain-free. Starting off with some adductor squeezes. So, in a couple of positions, a ball or towel between your knees, lying down here, making sure it's pain-free, bracing in the stomach and squeezing the ball between your knees, making sure you're breathing properly. You can do this for about 30 seconds with 10 reps. It's an endurance exercise. Again, making sure that it's pain-free. If 100% causes pain, back off to 60%. That can also be done in this position here, legs straight. And again, same rules, just keeping the pain free. Squeezing the ball between my heels. As well as that, you have loads of other ones like bringing in your abdominal area here along with the adductors. So squeeze here, and then slight curl up and twist. Making sure you're fully controlled all the time and breathing all the time. As well as that, you need to go with your glute work. So there's any number of ways of doing your glute work, whether you're doing it in a sideline position like this, making sure that you can feel it there, or you're going into a prone position here and just engaging your glutes, pushing your heel to the ceiling, making sure that you have proper activation here. Again, making sure that everything is in. As well as that, going with your adductor lateral slides. All you need is a slippy surface. Again, standing on one leg, nice and controlled here. Pushing your foot down and out, like that. And down and all the way back in. Making sure you're nice and controlled. It's pain-free, but there is a little bit of downward pressure as well as going out and back in. That can also be done in this direction here. Again, nice and controlled, pushing your leg down and dragging it back in as well. Okay. As well as that, you can move on to single leg squats. So, small movement initially. Here, squeezing your glute to bring it back up. Nice and controlled, all pain-free. That can also be done on an unstable surface like this. So just in this position here. And that asks a little bit more of you. As well as that, you can also do just your basic wobble board training, just standing on a wobble board or a jaw disc for a couple of minutes. You also have your TheraBand, where you put it around your ankle and bring your foot across your body like that. Again, a little bit more dynamic work on your adductors there. Okay? As well as that, we have some more control work. So going with your running action here, get into that good position, nice and controlled. And just doing that motor pattern there. We also have an exercise called cross-country ski. Your standing leg moves and you exaggerate the other movements. Just doing this for a minute at a time can be done on both legs. As well as that, we'll also go into lunge patterns. So, forward lunge at 45 degrees, and also side lunge like that. You can progress all of those by doing it onto an unstable surface, like we mentioned earlier on. One of the later stages exercises to do, it's quite a difficult one, but a very good one for control of your glutes and the adductors of the pelvis. So, in this position here, hand on your glutes, you'll really feel them working. Go in this position and externally rotating with this leg. So that asks a lot of your adductor and your groin on both sides. Quite an advanced exercise. Okay, so there you have a lot of the rehab exercises. All the time, I think it's important to ensure rest of body training for the athlete. Early on, they should be able to do a lot of non-weighted stuff like cycling and rowing. You're going to monitor your program with the squeeze test, which basically is sit in this position here, and they just squeeze and record the pain out of 10 they feel in the adductor. They can do that after their exercises and also as they progress through the running. I wouldn't get someone running until they're about 1 out of 10 on that squeeze test. Starting off with the running, I get them to be able to do a 20-minute run with no pain during it and no increase in pain the next day. After that, you start with straight line running, 10-meter acceleration, 10-meter deceleration, doing maybe 8 lengths and walk back, and you can progress that on to eventually doing 15 lengths and you're jogging back, so it's quite tough. If straight line running is okay, then you move on to a figure of 8 and your zigzag running. Again, monitor it all the time, but the patient can monitor it by doing that squeeze test directly after the run and the next morning. If it increases from a 1 out of 10 to a 4 out of 10, you know you've done too much, so you need to back off a little bit. Okay, to sum it all up, make sure that your thoracic spine and your lumbar spine, there are no restrictions there. Clear up any hip mobility restrictions and free up any soft tissue restrictions from anything that's attached to the pelvis. Then you go with the rehabilitation. There's any number of exercises, starting off with your static work, moving on to more dynamic work. Thinking strength and endurance of the whole pelvic area, a lot of pelvic control work. Rest of body training can be done at all times, whether it's cycling, cross-training initially, then you move on to your running. In terms of your running, you go with straight line exercises onto zigzag figure of 8 running. In terms of your rehab program, let pain be your guide. You and the patient can monitor the pain with the squeeze test. And research has shown that there will be more successful outcome with this if you monitor the rehab program, especially in the first few weeks, until you're confident that the patient can work away on their own. For more information on any of this, check out my blog on activephysicaltherapy.ie.